Have you ever wondered whether it's possible to safely increase penis size, or what it means if your urine stream sprays in different directions? Welcome back. Today, I'm your host, Dr. Rena, a urologist and pelvic surgeon. The first question. I tend to get stuck in my own thoughts with women. I overthink staying firm during sex, and that sometimes makes me lose my erection because I'm focusing on it too much. I'm only 24. So it's hard to believe I have a medical condition causing erectile dysfunction this early. I do go on dates, so finding partners isn't the issue, but I overanalyze the sexual part because I want women to feel satisfied with my performance. I've already lost my erection with 2 different women, and I really don't want that to happen again. This question is from TS. All right, TS, this is actually a very common concern. At some point, nearly every man experiences issues with erections. Erection firmness can vary over time depending on stress levels, temperature, how much alcohol you've had, or other substances you may have taken that day. All of these factors can influence erectile function. The first time it happens, it can feel very stressful. Part of the problem is that we're not taught that erections can naturally fluctuate. So first, understand that what you're experiencing is completely normal. Then, what often happens is you start worrying about not getting an erection, and the next time you're in a sexual situation, your thoughts are focused on questions like, will I get an erection? Can I maintain it? Will I be able to perform? Instead of being present and enjoying intimacy with your partner, it creates a cycle of anxiety that keeps repeating, because then you either don't get an erection or it doesn't last, which makes you even more anxious the next time you're intimate. And the cycle just continues over and over again. So first, yes, at 24, it's quite uncommon to have organic erectile dysfunction. However, interestingly, studies have shown that in men under 40, about 87% actually had an underlying medical condition contributing to their erectile issues. So even if it feels mostly mental, it's still very important to visit your primary care doctor for a proper evaluation. Sometimes, erection problems can be an early warning sign of future heart disease or other cardiovascular concerns, because the blood vessels in the penis are smaller than those supplying the heart. This means symptoms may appear there first, before any heart-related signs show up. Now, let's focus on what you can do. First, for men dealing with psychogenic erectile dysfunction, seeing a specialist can be extremely helpful. A psychologist or a sex therapist trained in this area can help you manage the stress and anxiety around performance, which is very important. Another approach you can try, especially if you're in a relationship where you feel comfortable communicating, is to temporarily take penetration off the table. The first time you're with your partner, you can say something like, "Let's just explore each other's bodies, focus on touch, and enjoy the experience," without involving the genitals. This allows you to reconnect with physical sensations instead of focusing on performance. Then, as you begin to feel more relaxed and notice you're not fixated on your erection, you then gradually move into touching the genitals. And once you feel at ease with that over the next few encounters, you can slowly return to having sex with your partner. Another option is to speak with your primary care doctor or a urologist about trying medication. Medications such as sildenafil, tadalafil, or vardenafil can make it easier to achieve an erection. You still need stimulation to initiate it, but they can help you maintain it. While you're working through these challenges and rebuilding your confidence in your ability to get and keep an erection, using these medications for a short time can be helpful in restoring that confidence. All right, moving on to the second question. He's asking whether performers in the adult industry are naturally born with larger penises, or if they're using enhancements, such as surgery, supplements, or specific techniques. Let's address this from the perspective of what enhancements may exist, and what men are often curious about. First, it's important to understand that individuals who enter the adult industry often do so because they already have certain physical characteristics. The average penis length worldwide is about 5.4 inches, and around 99.7% of men have a penis smaller than approximately 7.2 inches. This gives you a sense of what's considered typical. Now, when it comes to men seen in pornography, when it comes to penis length or girth, the camera can play a big role. Certain angles, close-up shots, and positioning can make things appear larger than they actually are. From what I understand, most of these men are not undergoing surgery to increase the length or girth of their penis. However, there are options like fillers that can increase girth and traction devices that may slightly improve length in some individuals. They also commonly use medications or other medical methods to help maintain erections for extended periods. This can include drugs like sildenafil, tadalafil, or vardenafil. In some cases, they may use what are called intracavernosal injections, where medication is injected directly into the penis to increase blood flow and produce an erection very quickly. Some men may even have an inflatable penile prosthesis implanted, which allows them to maintain an erection for as long as they choose. While this doesn't increase penis size, it is a treatment for erectile dysfunction and has the added benefit of giving control over erection duration. So yes, the adult industry often selects individuals who are already on the larger end of the spectrum in terms of genital size. They may also rely on camera techniques to enhance appearance, along with medications or procedures to improve girth, length slightly, or the duration of an erection. The key point to understand is that the adult industry does not reflect what real-life sex is like. What you see is designed to entertain, surprise, and keep viewers engaged. It's not an accurate representation of normal sexual experiences. It shouldn't be used as a standard for comparison or as a substitute for proper sex education, because the people shown are not representative of the average person. Now, there's a third question. Sometimes when I urinate with force, the stream splits into two. What could be causing that? This question is from GV. As a follow-up, I also see people asking why their urine stream sometimes goes to the right, the left, or sprays unpredictably. What's going on there? There are a few reasons why you might experience what's called a split or deviated stream. Think of it like a garden hose. When there's no obstruction, the water flows out smoothly and straight. But if you partially block the hose with your finger, the water sprays in different directions. Similarly, any kind of blockage in the pathway where urine exits can cause a split or uneven stream. So what can lead to these blockages? A very common cause is an enlarged prostate, which can partially obstruct urine flow as it travels from the bladder out of the body. Another possibility is a narrowing of the urethra, less common but something we do see. If you notice symptoms like a weak stream, splitting, straining to urinate, difficulty starting, or a stop-and-start flow, it's important to consult a urologist. There are effective treatments available for these conditions. Another factor is that after ejaculation, a small amount of semen can remain in the urethra. This can temporarily act like a blockage, so the first few times you urinate afterward, you may notice a split stream. This is very common. If everything else in your health is fine and this is the only issue bothering you, it's still worth getting checked, but one simple adjustment is to sit while urinating. While this isn't as common in the United States, in countries like Germany, many men do sit to urinate. It can make things easier to manage while still maintaining comfort and quality of life. And as always, take care of yourself, because you're worth it.